Hi, this is Dr. Justin Marchegiani here, and today's talk is going to be on vitamin K2 and its many benefits. Again, everyone's very concerned, especially as they age, about osteoporosis and their bones weakening. And everyone tends to, the knee-jerk reaction tends to be going towards calcium supplementation. And that may not be the best thing. Calcium can be an intermediary in inflammatory reactions, and our body can even line our arteries. Part of that plaque there is actually calcium buildup. So we really want to be careful with essentially throwing more fuel into the fire. We want to look at other nutrients that can have a anti-inflammatory effect and also have other synergistic effects in our health, like reducing heart disease, reducing cancer, increasing our dentin or our teeth strength, as well as bone strength as well. So let's talk about vitamin K2. So there's two kinds of vitamin K. There's K1 and there's K2. You can see here, K1 is primarily plant-based and K2 is primarily animal-based. K2 gets broken down into MK4 and MK7. And MK7 is primarily your fermented vegetables, your natto and your sauerkraut, kimchi. The fermentation really is the MK7 variety, while the MK4 is converted by animal tissue. So we're going to see MK4 very high in grass-fed butter, grass-fed beef. We're even going to see it in pasture-fed eggs as well. And again, we can actually convert K1 to K2 in our gut, but it's not really that efficient. And most people have gut issues or dysbiosis or SIBO or chronic gut infections. That conversion is going to be even lower. So we really want to work on getting high-quality animal sources of vitamin K2, especially the MK4 variety. And again, we have the menaquinone and the phylloquinone. Those are the technical names, K1 and K2, to keep it simple. So how does K2 work? So let's just focus on the bone building side of K2, because most people, especially women, especially menopausal females, they're really concerned about bone health. So we have calcium kind of hiding around or flowing around through our arteries. This is our arteries right here. That's our artery. And what's happening, we have calcium molecules flowing around in the arterial vesicles there. And when inflammation occurs, let's say damage occurs, typically calcium comes in to clean up along with cholesterol as well. Now, again, not that calcium's bad, but again, if we put a whole bunch of it and we're taking it high amounts, supplementation-wise, it may not be the best thing, especially if we're inflamed. Now, if we start upping our K2, let's say MK4, for instance, like in grass-fed butter and or grass-fed beef or eggs or even liver and such, what that does is it actually produces a compound known as osteocalcin. And osteocalcin, it takes the calcium out of the blood vessel and brings it into the bone. Okay? How it does that is this. It increases osteoblasts. So the B in osteoblast, think of B for blast as B for builder. That's going to help build up that bone there. It's also going to increase our active vitamin D, all right, calcitriol, or 1,25-hydroxy vitamin D. And next, it produces osteocalcin, which does all those other things there. So it increases the osteoblast, it increases the calcitriol, and that's all facilitated by the osteocalcin. And that's taking all of that calcium out of the blood and putting it into the bone. So we make a giant assumption that when we're taking in calcium, that it's just going to go from the blood vessels into the bone. Not necessarily true, but if we get the vitamin K2 up, we have a higher chance. Also, if you have teeth issues, if you have concerns with cavities or weakened enamel or dentin, as it's technically known, getting high quality sources of grass-fed butters and then really help build that up. Now, a little background history on vitamin K2. A dentist by the name of Weston A. Price, he traveled around between 1920 and 1930-ish, and he basically did anthropological research studying various cultures. And what he found was the cultures that consumed higher amounts of what he considered activator X, which is known as K2 today, had more robust health. And what he found was that the cows or the sources of vitamin K2, if they came from grass-fed or pasture-fed sources, they were 50 to 100 times higher than if they came from grain-fed sources. So we know animals eating a natural environment of healthy grass or pasture-fed chickens and such, they're going to have higher levels of vitamin K2 in their animal products, which is important. So if we eat good quality animals or animal byproducts, we're going to have more robust levels of vitamin K2. Again, we talked about the mechanism with fractures, of how that helps with fractures in bones and also teeth. One of the best things you can do if your kid's getting cavities, pull out all the sugar, get good quality grass-fed butter in there. If you have a sensitivity to butter or maybe a little bit of the lactose or casein in the butter, good grass-fed ghee may be a better alternative. Again, builds dentin, also decreases association with heart disease. I kind of went over the mechanism here. I'll put some references below the video where you can actually check the scientific resources that I used to make this video. Again, decreased association with heart disease. Well, what's the mechanism? We're pulling all that calcium out of the arterial wall. It's anti-inflammatory. There have been studies on the fractures, or decreases hip and spinal fractures by 60 to 50% in Japanese studies, which is awesome. And again, decreased cancer risk, more than likely due to the mechanism of inflammation, right? Anytime we reduce inflammation, we strengthen our immune system, we increase our body's ability to build up versus stimulating it to break down. And sources of vitamin K2, I've kind of already alluded to this, but we have pasture-fed eggs, we have grass-fed beef. Again, Weston A. Price found that in pasture-fed sources and or grain, if we get the pasture-fed and or grass-fed sources, 50 times higher than grain-fed sources. Fermented foods, so you may want to use a soy-based fermented food like natto or tempeh or miso. Even though they're soy, the fermentation kind of decreases a lot of the deleterious effects of the soy. So fermented soy sources can be beneficial. Also, I recommend sauerkraut and or kimchi. Those are all very good fermented sources too. Even if you can tolerate it, raw fermented dairy sources can be beneficial. Also, K1, K2. So again, most people, they don't have the ability to convert K1 to K2. It's about 10 times less. So people are still getting some K2 from K1 plants. That's because of the conversion, but that conversion is 10 times less. So that may be happening, but we much rather get real sources, MK4. We're going to have higher amounts of serum K4. We're going to have higher amounts of serum K2 when we're getting our MK4 sources of vitamin K2 synthesized by our animal products. Also, really important to add that vitamin K has synergistic effects with vitamin D and vitamin A. So it's really important, getting these all three together is important. So I mentioned some of the vitamin K2 sources already, but your vitamin A, cod liver oil in the liver is going to be excellent sources of vitamin A. And then vitamin D, either through sunlight, you're going to get some vitamin D in the cod liver sources, and then also a good quality vitamin D supplement if you're not out in the sun enough. So using the synergy together is very helpful. Hope that video is really helpful. If you're having inflammation, you want to work on your bone health. Again, looking at the hormones is also very important too. If you want to dig a little deeper and get access to my video updates and newsletters, check below for more information. Again, this is Dr. Justin signing off.